Hi, and welcome to today's NephU podcast. I am Dr. Brad LaMotte, Senior Medical Science Liaison with Otsuka Medical Affairs. I am joined today by Dr. Neera Dahl, Associate Professor at Yale University School of Medicine, Section of Nephrology. Today, we will be discussing the future of healthcare beyond 2020. Welcome, Dr. Dahl.
Thank you. It's nice to be here, Brad.
Thanks. So we want to start off the podcast today by inquiring about how your practice has changed over the last several months. Obviously, with the pandemic, with COVID-19, it's been a huge impact to the practice of medicine and how medicine has been practiced. So what's changed for you?
So I would say that the response to that starts in a few phases. So when we knew the pandemic was coming, but it hadn't started, the cases hadn't really started increasing, the hospital and the practice made some changes. So we shut down the clinics. We moved as much as we could to telehealth. We really limited the number of elective cases and elective procedures. And so that really changed things for preparing people for dialysis or preparing people for transplant or doing some of those things that had already sort of a rhythm and momentum to it. Those things changed. And then some of those things that would have been elective or semi-elective procedures into the hospital also got postponed and changed. And then really during the pandemic, everything we did was supporting what needed to happen for the hospitalized patients. We had really quite a large number of patients in the hospital, and everything went to supporting that service. And then now, as we're in Connecticut, and so we're in the downside right now, sort of a very low state of infection right now. And we're just being very, very careful about how things are starting to reopen. So the clinics have reopened, but in a way that is de-densified, which is, I think, a post-COVID word for all of us, right? Which is we don't want crowded waiting rooms, and we don't want people certainly getting sick when they come in to see us. And so there's a very extensive screening procedure that has to happen before patients can come in. The waiting rooms are almost empty. The clinics, which used to be really busy, are quite empty. And there's plenty of time in between to clean rooms and things like that. And you know, initially we were trying to decide how we limit patients coming back, whether I was trying to decide, do I tell all of my patients over 65, I would rather see you as a telehealth visit, or do I leave it up to the patient? And eventually I decided that I would just leave it up to the patient to decide, do they want to see me in person? Do they want to see me as a telehealth visit or as a phone visit? Like whatever felt comfortable for them was what we were trying to do. And I think that's worked. I don't think I would have predicted who came to see us in clinic and who did not.
Interesting. Yep.
Yeah, it's some of the older patients were like, hey, this is the first time I've been out in 3 months. I'm coming to the doctors. I'm so happy, right? And some people who I thought were fairly low risk were still very reluctant to come out, which is fine, right? This is really has a lot to do with people's comfort levels with what they're expecting, what they're anticipating, what we're able to reassure them with in terms of what coming to the clinic feels like and what it looks like. You know, I think the other place for us that really got hit in a major way was our clinical trials program. So all of the recruiting for the clinical trials program essentially stopped while we were preparing for the pandemic and during the pandemic. And we're just reopening that in a very, very slow way. But you can imagine if people are reluctant to come in for necessary procedures or elective procedures, that they're even more reluctant to start something new for a clinical trials program. So that has been, you know, something we're still trying to slowly sort out. So some of it was just, could we have the patients come in or not? Should we be recruiting or not? Should we be asking patients to come in or not? But then the other part of that was what the hospital was able to provide. So if it was a study that needed a MRI or needed an eye exam or needed some kind of procedure done in the hospital, even when the main phase of the pandemic was over for us, some of those things hadn't come back online yet, right? So the eye clinic
Right.
was only seeing emergency patients and things like that.
Hmm.
And so it's been, I think, a huge adjustment for all of us, a huge adjustment to learn how to do telehealth, how to do it well, how to make sure follow-up happened, how to make sure appointments got scheduled. And then and I think it's also been a huge adjustment for patients, but in some ways they don't know all of the changes that have happened into the clinic, so they have less facility in being able to access some of the services that are still available, or
Hmm.
less knowledge of those services that are still available.
Right.
And that's been a little bit of challenge, is communicating all of that information.
Oh, absolutely, absolutely. So knowing all of that and sort of evolving over the last 5 to 6 months, how do you view the future of patient care in terms of how you're going to conduct your visits? Will they be in person? Will they be virtual? Will it be some combination? Do you think there's going to be a huge paradigm shift in terms of how patients are seen by providers in the
Yeah,
immediate future, but then also, I guess, thinking beyond, a vaccine potentially?
yeah. So there are, the answer to that is in two parts. There are some things that always require the patient coming in. So the thing that absolutely stayed open during the entire pandemic was our dialysis unit. There was a
Of
little
course.
bit of difference between what happened in the in-center side and what happened on the home side, where we could still do some telehealth visits. But I would say in our outpatient clinics, for the foreseeable future, we're going to continue to have telehealth visits. I think the hospital goal is maybe about 30% of the overall visits will be telehealth visits. I think, unfortunately, what I'd really like is technology that supports that. So a lot of my patients can measure their blood pressures at home, for example. And for me, that's a really important part of the visit, outpatient visit. What is your blood pressure? How well has it been controlled? So if they're checking them at home, that's fantastic. But if they're not, then I'm relying on a blood pressure measurement from the last time they were in the hospital and the last time it's in our EHR. And there's limitations into what I can do. So I know in the telehealth field, there are lots of platforms to try and address that, right? The way telehealth was originally sort of conceived, it was the physician is in front of the computer screen. There's a nurse with the patient who's measuring the blood pressures, maybe even putting a stethoscope on so you can listen to the heart and things like that. But my guess is, in this post-pandemic sort of environment, that the way we think about telehealth changes, right? So it
Mhm.
really has to be completely virtual instead of being just a way to extend physician availability. And I
Right,
think
right.
that's the part that has to change, right? I would like to know what blood pressures are. I would like to occasionally like figure out how to feel an abdomen, or check for edema or things like that, right?
Mhm.
And without having to send a nurse or somebody else in there into the home to do that.
Gotcha, gotcha. And I guess, again, sort of the second part to that question is thinking beyond the vaccine. Do you anticipate some combination of telehealth continuing for the future, or do you think that post-vaccine things will return to normal, or what we thought was normal, 8 months
Yeah.
ago?
So I think that people have realized that virtual things sometimes make things easier, right? So for us, I think even after a vaccine, telehealth will continue to be open, right? There's an availability that I have for patients that I can do with telehealth that is not as easy when we're limited by the structure of the clinic, right? And the clinic opens at a certain time, it closes at a certain time. Only a certain number of patients can be seen, but then afterwards, for example, if I wanted to add on another telehealth clinic or something urgently came up, I could do that. Or for people that live far away, that they want a second opinion, or have a
Right,
question. In that case, I don't necessarily need to see the patient. I can have all of the data from the provider who saw the patient and give an opinion.
right.
Um,
Including images and laboratory values and things like that.
So in an ideal world, yes.
Right.
So laboratory values are easy because that's
Mhm.
just transmission of the data. Getting reports of images is easy. Getting the actual images has been a challenge because they're very large files.
Mhm.
How that information is shared has not ever been something that was meant to be done in these big EHRs, right? So we use Epic, which I think a lot of people use as our electronic health record. And Epic is great for connecting to other places that use Epic, so you can read notes and see labs and things like that. But it was never designed to connect to like a PAC system where you could look at the images yourself and
Gotcha.
make
Well,
an
that
assessment.
sounds like a need then, for sure.
Yeah, absolutely.
So moving on to the next sort of question, what do you think is going to be the main driver of the healthcare system in the future?
So what do you mean by that? Like, what's the main need for patients in terms of what the healthcare system of the future will look like?
Yeah, so what are patients going to need? I think maybe look at it in two parts. What are the patients going to need from the healthcare system, but also what are physicians going to need from the healthcare system? Because I think it's a twofold process. It's what you guys need as physicians caring for patients, but then it's also
Yeah,
what the patients need from the physicians.
yeah. So I guess I'll answer that in two parts. I think part of the problem now is that and particularly with all of the issues sort of forced upon us with the pandemic, there's a lot of fragmentation. So there are things that are happening by phone, which qualitatively aren't the same as the things that are happening in person visits. And so decisions are being made not always with complete data sets. So I think what has to happen in the future is that we sort of figure out a way to protect ourselves from that kind of fragmentation, right? So really to make the sort of virtual visits better, right? So maybe, I think there are already cameras so people can show me if they're worried about a rash or something like that
Right.
on a camera. But I think beyond that, looking at stuff is going to be more complex. And then sort of figuring out if we're all on the phone with patients, who's that one person who's really then still driving the ship, right? Like, is it the primary care doctor who's getting all of that information and synthesizing what's coming from all of those visits? I think we've made it harder to have that kind of, really global comprehensive care.
Hmm.
And so what I'm hoping will happen in the future is that we'll figure out a way to make it all more seamless, right? To make it all kind of build on
Right.
itself.
It sounds to me like it's really more about optimizing the technology and optimizing the way that information is shared and
Yeah,
optimizing the patient's ability to communicate with you.
yeah. I think that all of that is true. So for example, my office, so it's part of a large practice cohort, and the gatekeepers to that are the people in the office. And when in the height of the pandemic, the office was closed. So we were trying to figure out, but we were still doing telehealth visits. So we were trying to figure out how to have the admins that run the office do that in a virtual way. And that became very, very difficult because, I spend maybe 10 minutes or 15 minutes on a phone call, but then all of the work that has to happen after that, the scheduling of the ultrasound or the lab draw or the making another appointment, that needs the office to happen. And that
Mm,
I don't think anyone's really thought a lot about how that technology gets pulled into a virtual platform, right?
gotcha.
Um,
Gotcha.
how do you connect to my office, which so far has been through a very complicated phone bank
Hmm. Okay.
and
Sure.
not
Sure.
easy? Yeah.
I think we've touched a little bit on the next question already in regards to what your concerns are for the future of healthcare. But do you have any additional thoughts on where we're headed and where we might find some speed bumps?
So I think my biggest worry is there was momentum in a lot of different areas, and that momentum pretty much got completely sidelined with COVID and with the pandemic. And I don't know if that momentum is ever going to be fully realized again, right? And in particular, I'm worried about things like, what does this mean for drug development for things that aren't COVID related, right? What
Hmm.
does it mean for trying to build innovations into clinical practice when we are not really sure what the structure of the clinical practice looks like anymore? And all of the healthcare systems took a pretty big financial hit. And so what are they going to be willing to support in the future? The kinds of sort of multidisciplinary programs need support, and they need money, and they need an infrastructure. And how are you going to build that when everyone's still just struggling to do the basics? That's
Sure.
what I'm worried about. That really what we go back to is a different kind of care where maybe it's not so accessible. It's really focused on, like, what are those things you truly need as opposed to what are those things you truly want
Right.
um, in delivering the care.
Okay. No, that's great perspective, and I think coming from you and from the institution that you work at, I think that's probably very relatable to a lot of folks that work specifically in academia, but I think a lot of that'll translate to the community as well, where they're stretched even thinner than you are
Yeah.
sometimes. Um, No, that's great. Thank you.
Yeah.
And the last question for now, kind of brings us back to the platform that we're on right now and the community that we're on, and that's formerly PKD Network, but now NephU.
Mhm.
Um, and how has NephU impacted you specifically during this time of uncertainty with the pandemic and COVID-19?
So, one thing that's really truly changed, and so I'm an academic nephrologist, and a lot of what I used to do was go to meetings and meet people at meetings, and there was a lot of information sharing that happened through that. And that also has completely been put on hold. So there are meetings that still happen, but they're virtual meetings, and some of that sort of organic conversation that happened in between when you were waiting for another talk to start no longer happens. And so a lot of what I'm worried about is that a lot of information sharing has stopped, and it still happens in sort of the minute to minute way with Twitter or something like that, but the main sort of information sharing that used to happens in different ways. And so I found myself going to NephU to just see what's new, what's current, what's relevant, what's changed in PKD since the last time I was at a PKD meeting. And I found that really helpful. And I actually I think people tend to feel isolated, right? When you're working from home and you don't have a
Absolutely.
connection where you're seeing people,
Hmm.
to go onto that website and see and read real stories of people, kind of see little vignettes of things. I actually found that really enjoyable. It was a way to kind of connect with the work I do when it wasn't possible to do that in any other way.
Absolutely. Awesome. Thank you so much for joining us today. And I think that will wrap it up for myself, Brad LaMotte, and Dr. Neera Dahl from Yale. And we really appreciate it. Thank you.
It's my pleasure. Thank you.